This year, an estimated 310,720 new cases of breast cancer will be diagnosed in women in the U.S. And according to recent data, there is a trend showing an increasing number of women under the age of 40 being diagnosed with breast cancer. Joining us today is Dr. Al-Jannati, the Vice President, Department Chief of Cancer Care Services at Corewell Health. Doctor, thanks for being here to talk about breast health during Breast Cancer Awareness Month.
Thank you for having me.
Yeah. Well, first, are you seeing more cases of breast cancer in women under the age of 40?
Yes, this trend has been published and reported now for a couple of years. Unfortunately, increasing number of women are diagnosed with breast cancer even before we start the normal screening age for this disease. And we could talk a little more about perhaps why this trend has been noticed again. The incidence is on the rise.
I know the guidelines have changed over the years. So what age should women have their first mammogram, and how often should you have a screening?
So I just want to make sure that we highlight an important point here. So the guidelines that most people refers to what we call standard risk, meaning somebody who does not have increased risk for breast cancer. Standard risk, any other person who doesn't have a strong family history or did not have exposure to radiation at young age to the chest area. And for those individuals, the screening starts at the age of 40. And we recommend that they undergo at least initially every other year, but then later every year that this screening has to be maintained. And it should go on until they always should have these discussions visited with their primary care physician, who will actually guide them on until what age this will continue. But mostly we accept, as long as the person is in good health and have good life expectancy, is to keep doing screening until at least in their 70s.
And to lower the risk of developing breast cancer, what should women be doing?
So that's an excellent question, because there are few risk factors that we don't have control, right? Family history, if a small number of people would have inherited certain genes that increase breast cancer, and those have separate guidelines in terms on when they start screening, what method of screening, because not only mammogram for those people with high risk, sometimes we have to add MRI to mammogram. But the lot of things that we can do is those what we call the risk factor that under a person's control, such as diet, exercise, alcohol. Alcohol actually, and it's written clearly in the guidelines everywhere else, any amount of alcohol actually increases the risk of breast cancer. So there is no safe amount. And it would be best if a person is able to avoid alcohol. But for those who cannot do that, they have to minimize the intake of alcohol. And that would be probably not to exceed 1 drink per day and no more than 3 drinks per week. Is excellent healthy lifestyle, because those will usually lead to weight control, because we know obesity and overweight are other risk factors for breast cancer. Smoking is, but to a lesser degree actually, of the first two I mentioned.
And Doc, if a lump is found or someone is diagnosed with breast cancer, what does treatment look like these days?
So we are really in times that where we have many individualized option for our patients. Most of the focus in the research on how we can be less aggressive and yet give the patient the best outcome. So this day and age, surgery is very well takes into account the patient's values. Some patients still might prefer mastectomy, but it's not necessarily done as often as it used to be done in the past. Lumpectomy, which is just removing the mass and then followed by appropriate treatment, is a common way to treat breast cancer, and it leads to excellent, of course, outcomes in terms of getting rid of the cancer and yet maintaining as well a cosmetic outcome, right? And also, not necessarily in the old days, lots of women had to have undergo a procedure to remove lymph nodes from their armpit. And this day and age also we have criteria to minimize the need to remove these lymph nodes in patient who does not necessarily need that procedure. So it will also add to their improved outcomes, meaning less intervention when appropriate leads to the best outcome. Most women will require additional treatment as well, whether it's hormone treatment and or chemotherapy and radiation. And also we have many tools to refine and only offer these treatment to the individuals, to the patient who really needs them. So the treatment has evolved over the past 15, 20 years differently than what it used to be.
All right, thank you for joining us, doctor. You can find this full interview on our website, woodtv.com.